you want to get rid of the active lumbar spinal stenosis, there's going to be 3 tests that you got to do. First one is going to be more based off history and symptoms. Because people with an active lumbar spinal stenosis is going to have typically the inability to walk or stand for long periods of time without getting that low back pain and leg pain that's more relieved on when you bend or you sit and rest. Also, they're going to have the inability to do a lot of extension type of exercises because lumbar spinal stenosis is a narrowing of the nerve canal where the nerves pass through, carrying vital information to keep your body healthy. With lumbar spinal stenosis, it's that narrowing that puts that chronic pressure on. So when you do an extension type of exercise that further narrows that canal and creates an aggravation of the symptoms and makes the lumbar spinal stenosis worse. So exercises that are classically used for people with low back pain, like the Superman or the Cobra, you want to avoid those type of extension type of exercise initially. Second diagnostic tool is going to be x-ray. You want to do standing postural x-rays to where you take an x-ray from the front of the body and the side of the lumbar spine. This way you can, number one, you can see the alignment of the joint. You can see if you have the joint moving forward, anterior listhesis, or moving to the side, which is lateral listhesis, or maybe it's moving backwards and it's causing a retrolesthesis. All those can create a narrowing of the canal and create a stenotic situation, putting pressure on the nerve. Also, you want to see if there's any bony growths like bone spurs that can further narrow that canal. Third diagnostic test is the gold standard. That's the MRI. The MRI is going to pick up and it's going to show all the soft tissue. So it'll show if there's disc herniations or disc bulges that are migrating, narrowing the canal, or it's going to show the ligaments that's thickening. Maybe it'll show the bone spurs, can show fluid into the joint, or even cysts in the joints. Any of those can narrow the joint, create a stenotic situation, put that chronic pressure on the nerves. An important note that when you get an MRI, you can show that you have spinal stenosis, but you may not have any type of symptoms that we talked about before that most people would get with lumbar spinal stenosis. Now, I find the best treatment for people with active lumbar spinal stenosis initially is to do flexion-based type of exercises. So, for example, we use abdominal curl-ups to where you lay on your back, you brace your abdominal muscles as if someone's punching you in the stomach. You make a fist and you curl up and reach towards your feet, and you hold that position for a 10 count. Now, contracting those abdominals are not only going to strengthen abdominals, but you're being in a protective position to where it's not going to allow the little micro slippage of the joints. It's going to flatten out the lumbar spine and open up those narrowed nerve canals to where it's going to take pressure off the nerves. Now the nerves start resting and healing and get ready for a phase 2 of rehabilitation. So you want to do the abdominal curl-ups to where you curl up for a 10 count. You want to repeat that 10 repetitions. Next exercise is going to be the angry cat. Like the cat-cow, you get on all fours and you emphasize the flexion. So you hold that flexion for a good 10 count and then move back into slight extension and move back into flexion. So you're just emphasizing the flexion, hold it for a 10 count, do 10 repetitions. Last exercise is going to be to free up the hips and to contract those glutes while you're stretching out the psoas muscles. So you're going to get more in a kind of a frog stance, leaning up against a bench or your bed. Sit up and extend, contract the glutes, and come back down. So you want to come back up and contract the glutes and hold, and then come back down, do 10 repetitions. You're going to feel it stretch those hips out, free up the hips. Always going to be strengthening up the glute muscles, which will help support the whole spine. You want to perform these exercises 3 to 4 times a day until those symptoms are lessened. Then you can move into a phase 2 of rehabilitation for lumbar spinal stenosis. Now, if you want to find out how to get back walking properly and walk for miles at a time with lumbar spinal stenosis, check out this video right here. If you're new to my program and you want more home-based spinal exercise programs, make sure you subscribe, share with your friends. We really appreciate serving you. Keep spreading the word, and we'll see you in our next video.